Hello and thank you everybody. Welcome to the second webinar in this digital discussion series. It's a collaboration between Meaningful Business, Alliance for Impact and Impact 17. The topic of this one is driven by the demands and the requests we had after the first digital discussion. Now we're moving on to connecting needs to resources during the pandemic. Before we launch into the webinar, we have some key messages to share with you on behalf of the World Health Organization regarding the COVID-19 crisis. So the first message they would like us to reinforce on their behalf and to pass on to companies in particular is to prioritize, please, the health of your staff and the local community and your customers as much as possible. Think local is essentially the message there. The second message is to focus on business continuity. Although the immediate needs right now are health needs, also the economic impact of this crisis is of great concern too. So please look inward and look at your own business to ensure continuity post the crisis. Also, it's extremely important, considering the mass of information that is out there, to refer to and to amplify as much as possible the information and guidance coming from the World Health Organization. The subject of this topic, connecting needs, is one that's been coming to the World Health Organization from a variety of angles, and they would like to reinforce the fact that there are efforts in process to develop platforms that connect the needs with essential supplies, one of which, and the priority one at the moment, is being developed by the World Economic Forum in collaboration with partners, and it's the COVID-19 Action Platform. The priority for the World Health Organization for health needs is financial, and they are asking and coordinating the response through funds on the COVID-19 responsefund.org platform. So if you are able and willing to contribute financially, this is the place to go for those kinds of contributions. We'll be hearing later on about other calls for financial support that cover different aspects of the COVID-19 crisis. And finally, the final message for today from the World Health Organization is to complete, if possible, the global survey from the ICC. We'll be sharing this information with you later on. So obviously you probably haven't been come ready to write this down or record this information. So we'll be sharing it with you, those that have registered for this call, soon after. So following those messages, we're really pleased to have with us today three excellent speakers who are on the front line of what's going on with the COVID response crisis. The first speaker we'll be hearing from is Sahba Sobhani, the director of the International Centre for the Private Sector in Development from UNDP, the United Nations Development Programme. And after Sahba, we'll be hearing from Alessandro Fedele, the global head of the private sector unit at the International Federation of the Red Cross and Red Crescent Societies. And then finally, we'll hear from Laurie Foster, the director of corporate strategy from the International Association for Voluntary Effort. And welcome, Sahba Sobhani. Thanks, Sahba, for joining us. And I'm going to hand the floor straight over to you. Please go ahead.
Thank you very much. It's a great pleasure to join you all virtually here. I'm based out of Istanbul, but with a global remit, and very much been involved at UNDP as part of the COVID-19 response. What I will speak about is more the big picture as it relates to what we see around what's happening around the world. Secondly, how it affects businesses, and also what the UNDP and the UN system has been doing to address this. As you have seen headlines in the last couple of days, we've seen things that say global poverty might be, go back 35 years, 200 million people will lose their jobs. There's all kinds of scenarios around GDP, growth or non-growth scenarios. We do know as the virus and the pandemic is moving across countries that there's a lot of, uncertainty in terms of some of these modelings. I mean, we definitely are looking at either muted growth or more likely deep recession. I mean, if you heard Ray Dalio talk about on Facebook, on TED yesterday, he said we're back to a period of 1931 to 1933. But that's sort of the global situation. It's all based also on the set of interventions that governments will be doing, their policy response, coordination between governments, and also sort of as you said, the WHO-led response with other actors. What we do know at a country level, based on the framework that we have at UNDP, is the COVID economy ruptures alliance of supply demand in three ways. You have a pre-surge, countries that are just entering number of cases is just starting to grow, where there's reduced demand in service industries, transportation, hospitality, entertainment, and a rising but serviceable demand for COVID-19 response goods. So we have a set of countries that are in those. Then you have really when the surge happens, now I think in Turkey, for example, in some of the other countries that are on that trajectory, you see a bit of a collapse of markets. We just did a survey yesterday with 800 companies in Turkey that showed, collapse of markets by 50 to 70% for sectors that are involved, in basically tourism and some of the other ones. And you see some business adaptation of goods and services, home delivery of food, medicine, goods, some non-healthcare producer pivoting to critical supply chains, hygienes. In Turkey, for example, the government lowered the ethanol sort of alcohol requirements to pivot companies towards sanitizer making. In some other countries, you see pivot towards PPE making, components for hospitals. And then you basically, what we're trying to look is a post-surge situation, which hopefully, China is entering. But one of the clear things that we know in the last 1-2 weeks is these three. It's not a classical humanitarian logic of recovery. You might have a situation where you have quarantines that are also going to be in a localized fashion in the future being implemented. So the governments will have to basically look at these interventions in these three scenarios and three situations and try to implement it at the same time. The big picture, though, is in terms of trends. People forget that when SARS came onto the, in China in 2003, 2002, that led to the rise of e-commerce in China. Alibaba and all these companies came out of the SARS sort of situation. So you will see significant digitization processes, robotization. So we really have to think about what are the policy consequences of this shift. We're also very concerned, there was a call with WHO, there was a call by others about the importance of collaboration. When you look at food security across the world, even if there's no lack of shortage of food supplies, different countries are imposing export bans. When rice is being banned for export to Africa, for example, that has consequential sort of impact. Singapore just launched a $50 million emergency sort of funding for companies to start producing locally in Singapore, given the impact that they're facing. So when you look at these different kinds of business challenges, you really have to look at the impact on the informal sector, the SMEs, the multinationals, the large national companies, and how they can respond as individual companies to safeguard their employees and their communities, how they try to address both first order issues like health in their supply chains, but then now increasingly with all these various restrictions that has had a huge impact in terms of global supply chains, how they can be able to adjust and adapt in the short run and survive. Actually, one of the biggest concerns we have at UNDPs, as we know from our work on natural disasters through the Connecting Business Initiative, that 90% of businesses that shut down within the first 4 months of an emergency don't open up. So there's a very important, the governments really have to think about what can be done to save our SMEs who are very much, at the forefront of economic. That's where I think the ICC's Save the SMEs campaign is an important sort of initiative. And also the impact on the farmers, the poor, at the base of the economic pyramid. There's been a number of companies like H&M and others that have made commitment to honor their contracts for the next 1 year. I mean, this is not a perishable good, but what does it mean for the coffee and commodities value chain? So we have to also see what are the types of business actions that need to be fostered. One, governments have a role to play to mitigate the impact on the SMEs. Secondly, there has to be a means to work with the multinationals in different supply chains to try to also mitigate the impact on sort of the workers. Part of it might be through pivoting, to PPEs and some of the other areas that there's demand. And third, we have to think about what is the impact in terms of food security across the world as it relates to these marginalized communities. At UNDP with OCHA, we host an initiative called the Connecting Business Initiative, where we very much have 13 business networks across the world from countries like Mexico and the Philippines, where businesses have come together to work on response, recovery, and preparedness. And many of them have been involved in the COVID-19 response. In the Philippines, PDRF, for example, brought together a coalition of actors in the food sector and made a commitment of $30 million in grocery vouchers that will be distributed among the urban poor, 1.5 million urban poor in the next month and a half. This is an outstanding commitment from them to try to address the immediate needs of their populations. They also are in this process, want to show to the government that there's an opportunity to work with the private sector in these kinds of food security issues, given the fact that you have surplus of food that's not being able to be exported. We also have in other countries where very curfews have been imposed. In Sri Lanka, where they have been involved in emergency operations centers of the government to coordinate sort of transport of various types of business logistics required in terms of the food and some of the other ones. I think there's another area which is also very important, and it's a call to action for the global multinationals. I saw that Medtronic recently opened its IP for other countries for the ventilators to use. So in the UN system, we very much are looking for technology transfer to other countries to localize manufacturing of some of these key goods and services. And then I think the final thing is that given the level of information that's being sent around, there's, it is also important for the global media and sort of social media platforms to be involved in terms of ensuring that the right kind of information is provided to people in terms of their personal health. And also maybe in the response, we see this rise of tech-enabled sort of, health and health sort of diagnostics. Alibaba Jack Ma Foundation, for example, just put online an appointment for doctors. You can go and get a doctor to sort of give you initial advice. It's actually meant more for medical professionals around the world to learn about what has happened in China. So these are some of the big trends that we see. And as far as the UN is concerned, we do have 3 pillars of response. One, as Andy mentioned, is the WHO response and the fund that aims at raising money to be able to provide emergency health products in countries that are affected. The second one, which is OCHA-led, is the humanitarian response plan that tries to address COVID-related response for refugees and vulnerable population in fragile and conflict-affected countries. And the third one, which UNDP is also playing a leadership role with the UN Secretariat and others, is looking more at this, what I mentioned early on, is how do we ramp up at a country level manufacturing of these goods? How do we build the capacity for the health systems? And also, how do we mitigate some of the long-term impact of these various as you know, also the multilateral development banks have mobilized up to $300 billion worth of funding, loan, grants to try to stave off this cataclysmic sort of economic impact. They're trying to various instruments just to maintain the lifeblood of the businesses to survive, you know. But there's also an opportunity to use this as a way to pivot towards a more resilient type of economy of the future that is not just going back to usual business. So I think it's very important, and this is where the UN's job will be, is to really ensure that when we look at the future, we're trying to reimagine that we don't go back to the same sort of fossil dependent, non-sustainable types of activities that we had before. Thank you for your time.
Thank you very much, Sahba. I have a question that somebody posted when they registered to attend the webinar, which I'll read out to you. Maybe you could just very quickly give a quick response to that. It's, how are you organising the collaboration between the private sector and the public sector, their needs?
Sure. As I mentioned, three levels. One is at the global level, you have the WEFs of the world that are coalescing and bringing multinationals together, you know, and they're interfacing with the UN agencies. From our side, and I think our colleagues at OCHA, what is important is to build the local connecting tissue between businesses. And we always say is the worst time to share contacts with businesses is during an emergency. So these local platforms like PDRF in Philippines, APAD in Sri Lanka, Senaset, that are working on disaster are becoming very much the platforms that are integrated into government and sort of disaster management capabilities. So that is, I think, the second one. The third one is really specifically directly UNDP being the largest procurer of health goods for governments. This technology transfer mechanism that we hope to activate with other partners would be critical. I mean, we saw that happening during the HIV/AIDS period. We do need to also really foster a ramping up of some of these manufacturing because the supply of a lot of these things are still limited. So that's how we're looking at our collaboration.
Great, thank you very much, Sahba. Please hang around, and as the attendees on this webinar post questions, which I hope they will, please try and answer them in the chat directly. And then when all the panelists have spoken, we'll take some verbal questions from the floor as well. With that, I will hand over to Alessandro Fedele from the International Federation of the Red Cross and Red Crescent Societies. Over to you, Alessandro.
Thank you, Andy. Hello, everybody. So I hope during the next 10-15 minutes, I can really share my experience in the management of this response to the COVID-19 and how I'm interacting with the private sector. I will try to structure my talks in 3 moments. First of all, I'd like to introduce a little bit what we are doing for the COVID-19. Then I was thinking in preparation of this workshop, which are my reflection on this, and I have identified 3 myths that I'm facing with in this very extraordinary response, and then quick do's and don'ts that I'd like to share with you, so then I can be ready for a Q&A session. So there is no time, I guess, to make a long explanation about IFRC. IFRC stands for International Federation of Red Cross and Red Crescent Societies. And we are just one component of the entire Red Cross movement, which include ICRC and the National Society. So I'm going to share with you mainly the experience as IFRC, but I hope I can also provide you a wider picture of the entire movement. So as IFRC, you know that we have recently launched an appeal of 100 franc, which is part of a larger appeal of 800 million. Until now, we have approximately a coverage of 20 million. So we still need to fundraise for the remaining 80% of the appeal. And basically, while we speak today, we are already working with 149 national societies out of the total of 192 national society, which represent the entire network that we represent. Now, what do we do as a coordination body? Basically, our activity is articulated in three main pillars. We have the health and care pillar, we have the risk communication and community engagement pillar, and then probably the most important role we have as a secretariat of the membership organization, the National Society Prepared. In terms of health and care, it's quite intuitive that we are working on epidemic response, mental health and psychological support, clinical and paramedical services, and then in terms of risk communication and community engagement, this is something that we are doing together with the WHO and UNICEF. We are trying to set up a global strategy and guidelines for country plan related to risk communication and community engagement. The third pillar is very much specific to, let's say, our mandate IFRC, because as also was already mentioned by Sahba before, we are very keen in community planning. This is for sure an extraordinary event, but we have also to think what is going to happen when the event is over and when we need to start again in a sort of business as usual. So we are assessing and providing support to assess the impact of this epidemic, and we are trying to emphasize the importance of capacity building for national societies. Now, with this in mind, I provided to Andy a lot of information that I'm going to share there, where you can also find a lot of links to download a lot of relevant information. Information and link about the guidelines on health, risk communication, and community engagement. And also it's important to know that within the large exercise, the large fundraising exercise we are doing, there is an important also dimension of non-food item needs. Just to give an example, we are looking for 5 million gloves for examination, more than 2 million professional mask, respirator N95, other type of more general surgical mask in the order of 7 million, and so on and so forth. So all this information can also be shared after this meeting. And you can also have a precise name, contact point of the different, let's say, business line of this appeal. You have a contact person for the operation coordination, for the planning, monitoring and evaluation, supply chain logistic coordination, the liaison with WHO, public health in emergency, communication, and so on and so forth. So we wanted also to use this opportunity to provide very concrete support for people that want to engage with us or want to really support our response. So with this introduction, it's clear that this is an extraordinary event for all of us, sometimes also personally, because this is not something that is happening far from our nice offices in the developed countries. This is something that is next door. Sometimes many of us have a friend that got the coronavirus. So it's something also emotionally very impacting. And therefore I was thinking that maybe it's interesting for you that I share the three paradoxes that I have identified in my experience in the last 3-4 weeks. So the first private sector is small versus big, in kind versus cash. It's clear that when I look at my role as responsible for private sector globally in the emergency context, normally private sector play a relatively small contribution in cash terms, in the order of 2%. When I look today and I project the potential fundraising, pure cash fundraising opportunity from private sector, I'm talking in the order of 20%. So clearly there has been an extraordinary response from big corporations to provide financial support to this initiative. Normally, IFRC as a coordination body, non-implementing organization, play just a coordination role and a relatively small role. On the contrary, we have launched a global appeal that we are coordinating from a global office of Geneva, involving and coordinating at the same time 5 regional offices, and as I said before, 142 national societies. So you can imagine that we are really, and also, as I said in the past, the role of private sector is important, but it's more in the in-kind part. For instance, access to satellite image to make an assessment of the situation after a flood, rather than logistic support. In this case, there is much more cash management. So this is the first paradox: small versus big, in-kind versus cash. The second paradox is long-term versus short-term. So the added value and the strategic role that private sector has in the dialogue with the humanitarian sector is normally in setting up a long-term strategic partnership. We normally define a thematic, we work together to develop a program. The program can be a program on wash, a program on education, a program on shelter, just to give you an example that I've been responsible for. Today, it's a completely different picture. Today, we are in a very short-term solution. It is action-oriented. It is about emergency. It is about, I take the money with the highest level of flexibility, and I decided in the most efficient and effective way how to use the cash that have been donated. So this is another important paradox that is new. So it's also the new for us when we establish a conversation with the private sector partners, existing and new. And the third paradox that I have identified is local versus global, in the sense that part of our philosophy as a Red Cross is really to have a sort of decentralized approach, where also there are a lot of bilateral conversation between the different national society. And normally our role as IFRC Secretariat is to provide that coordination support for the single national society where the disaster shock happen and where therefore there is a need for response. In this case, the situation is completely different. We are talking about a global pandemic that travel across the board very fast, with the characteristics that change all the times. So in this case, we are not local, we are not bilateral, we are global. We are asking to have money without no major earmark. We are working at the movement-wide level, because as I mentioned at the very beginning, the global appeal that we have launched is a coordinated global appeal of 800 million, which includes our 150 million, the 400 million coming from the national society, and then 250 million coming from ICRC. So as you can see, there is, let's say, we are putting in discussion all the guiding principle of the long-term strategic relationship between the private sector and the humanitarian sector, in my case, Red Cross, because we are in extraordinary situation where we are learning every day new things. So if I can do a very simple recommendation, I think don't come with a business as usual proposal or with this, let's say, ideas that maybe are interesting but are small in scale and require a lot of alignment. This is not the time for testing new things, a new approach, because we are really overstretched, overloaded. We just need to act to save lives every day. So unfortunately, it might look a little bit paradoxical again, but we can't test new things. We just need to run and execute.
We'll hand straight over to Lorrie, and then when Laurie's finished, we'll come back with some questions for the panelists. Over to you, Lorrie.
Thank you, Andy. I'm happy to talk about how IAVE's members, corporate members, are responding to the crisis. Just as a way of background, IAVE is a 50-year-old NGO that advocates for volunteering around the world, all forms of volunteering. And we do several things. We convene, we have World Volunteer Conferences on corporate volunteering and all other types of volunteering. We develop new knowledge about volunteering. We are in the process of launching a major research project on corporate volunteering. And we also facilitate networks. For example, there are national organizations around the world that promote volunteering. We have a network of those. We also have a network of global companies, the Global Corporate Volunteer Council, and a subgroup that meets to discuss ways volunteers help in disasters, both humanitarian and natural disasters. So my remarks are based on regular conversations we've been having with 50-some companies whose employees regularly volunteer. Normally we meet in person several times a year. Now we're meeting virtually several times a week. The companies we work with are deeply committed to volunteering in their communities and across borders. But in many instances now, they have suspended in-person volunteering for obvious reasons. Many of them have virtual volunteering in place and are doing some new virtual volunteering and are being quite creative. So employees, bottom line, are eager to volunteer. They are volunteering, but at the same time, as you've heard from Alessandro, nonprofit organizations are swamped. And this is not a good time to initiate new partnerships or new programs with a new partner. But there are many things that corporate employees can do and are doing. For example, funding, as you've heard, is very important. And what a number of companies are doing is offering matching funds. So in other words, they have a list of organizations that employees can volunteer to or make donations with, and the company will match, sometimes 1-to-1, or more recently, many are doing 2-to-1 to different organizations. Secondly, there is hands-on volunteering, community volunteering. Although most countries and communities around the world are asking people to stay home, there are still a need to deliver groceries to the elderly, to pack food for food banks, and people are stepping up and doing just that. Also, companies are sponsoring blood donations, blood drives, and companies and individuals are walking out to participate in those. There's a good amount of corporate organized virtual volunteering that's taking place. I found that particularly our members in Spain, such as Iberdrola, Telefonica, and La Caixa, have programs where employees are adopting a pen pal, perhaps in a nursing home or in homes for those who have disabilities, and writing to them or calling them on a regular basis to check in and see how they're doing. Some are even working with the Spanish Red Cross to do that. EDP in Portugal similarly has adopted a program where employees check in with a variety of those who are isolated. Also, companies are responding to what is becoming worldwide unemployment, and they are mentoring young people. They've had programs in place where they mentor young people to help them get jobs in the best of times, but these are not those times. And now they're focusing more on helping them get jobs right away. They are helping them to find jobs and also to practice their interview skills. All of this online with employee volunteers. Secondly, with schools closed down, there is a need for online content. Teachers are scrambling to learn new ways to teach online and are looking for content. So some of our members, such as IBM, is providing STEM content. Schneider Electric, the French firm, has had units on sustainable development, which they have now put into an online format. A number of companies have sponsored hackathons. Airbus, for example, recently had a hackathon where they had employee volunteers come up with ideas for the plastic visors that medical workers can wear to keep them safe, and came up with a number of good designs which they have put into place. SAP also had a hackathon with the German government where they came up with a way to track hospital beds that were open on a real-time basis. So very innovative uses of employee volunteers. At the same time, there are a number of ways that individuals, those on the line, company employees, everyone can volunteer to help respond to the pandemic. And there are 5 different ones that our employees particularly like. One is Career Village. It provides career advice from individuals such as those on the line who've had, robust careers, can answer questions to those seeking advice. Missing Maps is another online opportunity for volunteering. You can provide detail of your local community to Missing Maps, and these will help experts in responding to emergencies. Translators Without Borders is another online opportunity, and currently they're looking for help with COVID-19 specific messaging. I looked yesterday and they're looking for Chinese speakers, many different dialects, Thai speakers, Vietnamese speakers. This you can do from home. UN Volunteers has an online volunteering section that you can participate in and help all over the world in a variety of languages. And finally, MicroMentor is a popular and well-used platform that many of our members use to mentor small businesses. And Sahba talked about the urgency of getting small businesses back up and running, and this is a way to mentor those small business owners. And I'm happy to take any questions about how employees can volunteer or individuals.
Great, thank you very much, Laurie. Actually, we do have a question. If someone who wants to volunteer works for a company that doesn't have an organised response to COVID-19 just yet, do they need to tell their employer, given that they are most likely working from home?
Actually, it would be a good idea to let their employer know, because I could envision that companies would rethink, they definitely will be rethinking their volunteer programs, and this gives them a chance to see what employees have been doing, what they're interested in, and perhaps post-crisis to come up with some new partnerships with different organizations where those employees have volunteered.
Thanks, Laurie. We have a question from the floor from Anita. Anita, could you introduce yourself and ask your question to the panelists, please?
Hi there, Laurie. This is specifically for Laurie. My name is Anita Bieberg, and I'm from a company called Sahba Exchange. Sahba means volunteer. So what we do is we build an ecosystem that connects corporations, the volunteers, employees, as well as the nonprofits needing the volunteering, and communities that have all the individual volunteers together. We match basically the needs of the community with the interests and skills of volunteers. And I mean, we're still a startup, but I would love to work with you guys. We're global. We're giving our app away for free right now to all communities so they can help themselves immediately. if there's any interest from your side, I would love to speak to you later.
Definitely, Anita. Let's talk. Andy's going to post my contact information. Let's definitely get in touch afterward.
Okay, thank you.
Okay, thank you, Anita. There's been a question that came up in the chat, and it was submitted in a slightly different format when registering. And the question is about, this is probably for Sahba to answer. It's, do you see effective collaboration happening between multinational companies and SMEs at the regional, national, or local level? And how can you encourage that support of vulnerable SMEs by multinational companies?
Yeah, I mean, I think this is a sector-specific issue that needs to be addressed. As I mentioned, in the textile sector, with non-perishable goods, you have pioneers like H&M who've made a commitment that should be lauded, and they need to be, you know, through the existing sort of platforms that the ILO and others have set up with those folks, like the Better Works program, some mechanism to sort of to get more commitments of the sort that the H&M has. So this is, I think, for the global one. I think there's similar efforts that are being, that I'm not privy to share at this stage, in other sectors, in the commodity sectors. We have a green commodities facility at UNDP. There's a sourcing element to it, but also let's remember there's a food security element to it. I think that the biggest threat we have to think about is, you know, if rice from Asia is not being exported to Africa, there's different onions, you know, is a national security issue in India. It's often, so all of these sort of fluctuation of prices are going to affect significantly the poor. So this further reinforces the need for also resilient national sort of food systems that we need to develop as a result. So we have to look not just in terms of the immediate impact on markets, but also the sort of what are the long-term resilient approaches that we, I think in terms of digital, the telecom industry is getting very much organized. You know, as I cut and paste here, telecom technology, you know, Google, all these folks, Facebook have made commitments to provide up to $200 million of ad for SMEs to use. There's a very interesting article in the New York Times today that talked about how tiny little e-commerce sites and local production across the US have a multiplier impact in terms of economic development, even before the COVID crisis. So we need to look at the role of how we can enable more of those sort of virtual SME storefronts at a local level and enhance it with production through decentralized manufacturing, you know, sort of if you're doing a food production, more localized food production. Like I mentioned, Singapore is doing things on top of roofs, villages. So we really have to revisit the whole model that we have. I think the big picture is this. We looked at the world in terms of efficient supply chains. We have to understand, to have resilience, we need redundant supply chains, which means that while we maintain a sort of globalized world, we need to ensure that we have resilient, sort of localized supply chains that enable us to address the various. This is just the beginning. I mean, just to give you an example, in the middle of this, I had a call from our Vanuatu business, CBI Network. They just got hit by a Cat 5 hurricane, 150,000. I mean, that would have been a big news, but people forgot. And it's one of the few countries that doesn't have COVID-19. So some people are actually more worried about getting the disease than the Cat 5-19. And they're very grateful for the support of the international community, but they were begging to ensure that the volunteers are tested before they even arrive on soil. I mean, we know the history of what happens in these sort of countries. So the hazards are going to increase. We really need, this is going to be an opportunity to really think how we reimagine the future of a resilient business world, but also how we make our communities more resilient. Thank you.
Thanks, Sahba. Alessandro, I'm going to combine two questions for you. One is from Susie and the other is from Karsten. So the first one is about how you see fundraising changing, but I'll add into that also how you see engagement with the private sector changing after the lessons we've learned from this crisis. And from Carsten, it's more about how can we best get in contact with the country level COVID-19 task forces to provide the support that they need.
This is really in progress. I can make assumptions, and I think fundraising private sector will change for the organization where I work for, but will change in general, because I think private sector understand that there is a risk of, I think I expect that the private sector will engage more and will take also more seriously the commitment that I see much more talks than action. I wanted to see less talks and more action, to be honest. I'm involved in many panels, many conversations. I have also the honor to organize the agenda at Davos for my Secretary General. And I see a really disproportion between the talks about the private sector involvement and is active, substantial action. So I think this pandemic will upscale the role of private sector. In terms of connection to the national society, you can come back to me. I can provide contact at the national level. We operate through 5 main regional offices. So I have to say the beauty of the Red Cross network is that in few steps, we can reach the most remote place in the world. So please feel free to reach me out, and based on your request, I can facilitate the connection at the national and even more local level. Thank you.
Thank you very much, Alessandro. And as I said at the beginning, we'll be sharing in a follow-up the details of the speakers and with their permission, their contact details, so that we can facilitate some follow-ups. I'm going to turn to another question from the floor from Nia Tenenbaum. Over to you.
Hi, thank you very much. This is actually a great panel, so thank you very much for taking the time under all of this. My question is simply like this. So we are seeing ICRC or IFRC, we're seeing UNDP, and how can these large organizations or find partners in the field to actually give tools to the small communities who do not have the connections to UNDP or ICRC to make their own decisions better, to find their own solutions by themselves? Because we see hackathons and stuff, but these things take time and usually do not really provide a solution viable in the time of use. But how does UNDP or maybe even IFRC, ICRC see their role in enabling communities to help themselves rather than bring something to the communities?
Thank you very much, Nia. Who would like to go first with that, Alessandro or Sahba?
Sure, I'd be happy to respond to that. I think there are 2 things that we have to be cautioned. One is we have to also be very careful about introducing new types of innovations and technologies in the context of a middle of a disaster, especially a pandemic that we don't know what the impact is. I'll give you a concrete example. There's been a whole slew of chatbots that were developed to do remote diagnostic, and Science Stats just said that it doesn't really work, the physical sort of element. Of course, I assume you're not just talking about technology solutions. And the second thing I would note, let's not underestimate that in some of these countries, there are people, if you've been hit with natural disasters and different things, Ebola, in Africa, and we have a platform called the Business Call to Action. In places like Pakistan, they've been doing telemedicine remotely. Seher Kahani in Africa, they've been there. So some of these in countries, they've had solutions that actually, frankly, would lend itself more to the Western world, to Europe and the US in terms of how to be able to address this. So I think there's an opportunity to surface this. Of course, there's the question, in terms of bridging the digital gap in a lot of these countries, the infrastructure that enables digital gap, the issue of work. I saw videos yesterday from South Africa where you had informal market workers who are trying to still survive without, there's no UBI, universal basic income. So we have to think about what are some other measures that can enable these folks to work in a post-COVID-19 economy based on solutions that they develop and other sort of things that we can draw upon across the world. I do think if we're talking about global mechanisms, there's a number of not only hackathons, but there's going to be business challenge pivot that will be launched soon. But those have to go through a rigorous process to ensure quality assurance and to ensure that we follow sort of the WHO protocols across. So those are the sort of things that we'll be looking to support.
I'd like to thank all the attendees for joining this and to give you the opportunity to communicate with us the main issues you would like to be conveyed to the World Health Organization through this channel from the perspective of the private sector, and we'll be happy to convey those messages. We'd also like to hear from you what topics you would like to hear about on the next digital discussion forum, if there's ways that we can improve it, and who you would like to hear from. And we will approach them on your behalf and bring them to this platform and convey what we hope will be some practical messages and some guidance to you. But most of all, I'd like to thank Laurie Foster for joining us, and Sobhani from UNDP, and Alessandro Fedele, and my colleagues at Meaningful Business as well. Thank you all so much, and we look forward to communicating with you again in the near future. Thanks. Bye-bye, everybody.